A heart attack, medically known as myocardial infarction, is a deadly medical emergency where your heart muscles begins to die because it isn't getting enough blood flow. This is usually caused by a blockage in the arteries that supply blood to your heart. The coronary arteries, that is the arteries that supplies oxygen and nutrients to your heart muscle, when become blocked or narrowed due to a buildup of plaque, the blood flow of your heart can decrease significantly or stop completely. This can cause a heart attack. The lack of blood flow can occur because of many different factors, but is usually related to a blockage of one or more of your heart arteries. We have to remember that time is critical in treating a heart attack, and a delay, even a few minutes, can result in permanent heart damage or even death. So, what causes a heart attack? The vast majority of heart attacks occur because of a blockage in one of the blood vessels that supply your heart. This most often happens because of the plaque, a sticky substance that can build up insides of your arteries. That buildup is called atherosclerosis. So, who are at risk for developing this atherosclerosis? People with high blood pressure, high level of low density lipoprotein, that is LDL, in their blood, high blood sugar levels, a positive family history of heart disease, and certain lifestyle factors like people who consume more sodium, sugar and fat in their food, habit of consuming tobacco and alcohol, and lack of exercise. So what are the 4 signs of a possible myocardial infarction or heart attack? Worldwide data suggests that the most common 4 signs of a possible myocardial infarction or heart attacks are pressure, tightness, pain and squeezing or aching sensation in your chest or arms that may spread to your neck, jaw or even back. Chest pain or angina feels like discomfort or heaviness in the middle of the chest, or it can be severe and feel like crushing pain. Along with we have to remember that nausea and stomach discomfort might be a clinical representation of heart attacks, which can often be mistaken as indigestion. Again, some other less common symptoms include shortness of breath and fatigue, pain in abdomen, heart palpitations, and severe anxiety with profuse sweating. Next, a common question patients usually ask is, why do heart attacks happen at night or in early morning? Globally, researchers found that at around 6:30 a.m. the cardiac system sends out an increased amount of PAI-1 cells, that is plasminogen activator inhibitor 1, or also known as endothelial plasminogen activator inhibitor, which blocks the blood clots from breaking down. The more PAI-1 cells in the blood, the higher the risk for a blood clot that leads to a heart attack. Now we will discuss about some of the diagnostic criteria and tests. Heart attacks are usually diagnosed in an emergency room settings. A healthcare provider will diagnose a heart attack. The diagnosis of myocardial infarction or a heart attack requires 2 out of the 3 following components. Number 1, a positive history and symptoms like crushing pain in the chest, blood test to check the cardiac enzymes and ECG changes. Cardiac markers or cardiac enzymes are proteins that leaks out from injured myocardial cells or heart muscles through their damaged cell membrane into the bloodstream. The levels of cardiac markers rises over time, which is why blood tests are taken over a 24-hour period, because these enzyme levels are not elevated immediately followed by a heart attack. Some common blood tests to check cardiac enzymes are: number 1, the most important is troponin test. Troponin or the troponin complex is a complex of 3 regulatory proteins, troponin C, troponin I and troponin T, that are integral to muscle contraction. This is the most sensitive and specific test to diagnose the heart muscle damage. When your heart muscles are damaged, these troponin enzymes are released from the cardiac muscles into the blood flow. normal value of troponin T is less than 0.2 ng per milliliter. This test is the most useful test in acute MI. Other blood tests include CKMB test or creatinine kinase myocardial band test, also called as creatinine phosphokinase MB test. It is useful when skeletal muscles damage is not present. Now, when we talk about the ECG changes of MI, we have to remember that in the first hours and days after the onset of myocardial infarction or heart attack, several changes can be observed on the ECG. First, we can see a large peak T waves or hyperacute T waves, then ST elevation, then negative T waves, and finally pathogenic Q waves can be observed. The pathogenic Q waves are a sign of previous myocardial infarctions. They are the result of absence of electrical activity, as scar tissue is electrically dead and therefore results in pathogenic Q waves. In a 12 leads ECG, ST elevation can be seen in different areas, like for anterior wall we can see in V2 to V4 lead. For lateral wall, lead 1, V5 and V6 can be a diagnostic tool. For inferior wall infraction, lead 3 and AVF. But in posterior wall, we can see that ST depression with upright T waves. Treatment and prevention. Heart attacks require immediate interventions before going to hospital, like performing CPR or chest compression, as the first 1 hour after heart attack is called the golden hour, because if within this time blood flow cannot reach into the brain or the other vital organs, there might be a high chance that we can lose the patient. So if you want to know about how to give CPR, you can watch the video on simple steps of CPR, give it in the I button and also in description. Now, after reaching to hospital, after the test and medication given by your doctor may also send you to undergo a minimal invasive procedure called percutaneous coronary intervention or PCI, formerly referred to as angioplasty with a stent, or your doctor also want to perform a coronary artery bypass graft or CABG. In this procedure, your doctor will restore your blood flow by rerouting your veins and arteries so that the blood can move around the blockage and your heart gets proper blood supply. So we can understand that MI or heart attack can happen to anyone at any point of time. So taking preventive measures and lifestyle changes are necessary. Now, if you find this video helpful, share this information to others to create awareness. See you in the next video. Till then, take care, be happy and stay healthy. Ta-ta!